I want to be straightforward with you about something that almost never gets said in a routine appointment. And after 15 years in clinical practice, I can tell you it should be said a lot more often. The skin loosening over your knees is not a surface problem, and it is not a collagen supplement problem. What is actually happening is a 3-layer structural failure, and all 3 layers are failing at the same time, which is why nothing you have applied on top has made any lasting difference. Here is how to picture it. Directly beneath the skin on your knee sits a specialized cushion of fatty tissue called the infrapatellar fat pad. Its entire job is to prop the overlying skin outward and give your knee that smooth, taut contour. After 50, that fat pad begins to shrink. At the exact same time, the collagen scaffolding in the deeper skin layer is fragmenting, and the elastin fibers, the ones responsible for recoil, for skin snapping back, are losing that ability permanently. So you have the internal cushion deflating, the structural weave loosening, and the elastic recoil disappearing all simultaneously. Every cream, every firming lotion, every general collagen supplement you have tried was aimed at the outermost layer, a layer that is not where any of this is happening. I am not saying that to make you feel bad about what you have tried. I am saying it because the moment you understand which layer is actually failing, everything about your approach changes. And the protocol I'm about to walk you through is built specifically around all 3 layers, in the correct order, from the inside out. Root Factor 1. MMP enzyme upregulation. The first factor is the one that initiated the entire breakdown process, and it involves a class of enzymes your body produces that most women have never heard of, because understanding them requires knowing what estrogen was quietly doing for your skin your entire adult life. You might be thinking, I know collagen declines with age. I already take a collagen supplement. And here's the critical gap in that thinking. The problem is not only that your body is producing less collagen. The deeper problem is that a specific class of enzymes called matrix metalloproteinases. Matrix metalloproteinases simply means a family of collagen-destroying enzymes whose activity is directly regulated by estrogen, became chronically overactive the moment your estrogen levels declined at menopause. Here is the exact biological path. Estrogen was performing a second job your whole life. It was suppressing MMP activity in your skin. When estrogen dropped, MMP production surged. And it surged most aggressively in the zones of your skin that experience the highest mechanical stress, because physical deformation of skin tissue independently triggers MMP release. The knee is one of the most mechanically stressed skin zones in your entire body, flexing and compressing thousands of times every single day. A study published in the Journal of Investigative Dermatology found that postmenopausal skin shows MMP activity levels up to 50% higher than premenopausal skin in the same individual. 50% more collagen destruction, running continuously, every day. This is why taking a collagen supplement without addressing MMP activity is like refilling a bucket with a hole in the bottom. You add collagen, the enzymes destroy it faster than it can be used. The hole must be addressed first. 2 cups of green tea daily, brewed for a minimum of 3 minutes to fully release the active compounds. Green tea contains EGCG, epigallocatechin gallate, simply means a potent polyphenol compound that directly inhibits MMP enzyme activity at the gene expression level. Research published in Experimental Dermatology confirmed that EGCG reduces MMP1 and MMP3 expression, 2 of the primary collagen-destroying enzymes, by measurable margins in skin tissue. Brew it, drink it, 2 cups every day. The first cup in the morning, the second in the early afternoon. The second factor is one that no skincare brand will ever tell you about, because if they did, you would stop buying their products immediately. Root Factor 2. Infrapatellar fat pad atrophy. Here is a structure inside your knee that you have almost certainly never heard of. And once you understand what it does, you will immediately understand why no cream, serum, or topical treatment has ever made a lasting difference to the appearance of your knee skin. Your first instinct might be, fat loss around the knee sounds like it should be a good thing. I do not want fat there. And that response makes complete sense on the surface. But the fat pad I am describing is not cosmetic subcutaneous fat distributed randomly beneath the skin. It is a highly organized, structurally specific tissue called the infrapatellar fat pad, and its entire function is to mechanically prop the overlying skin outward, giving the knee its smooth, firm contour from underneath. When this pad atrophies simply means undergoes progressive tissue volume reduction due to cellular loss. The skin above it loses its internal support structure and begins to droop and fold, regardless of how much collagen is in the dermis or how firm the underlying muscle is. Here is the biological path. Adipocytes. Adipocytes simply means the specialized fat-storing cells that make up the fat pad, require a healthy inflammatory environment and adequate fatty acid supply to maintain their volume and organization. After menopause, elevated systemic inflammation and declining estrogen both accelerate adipocyte apoptosis. Apoptosis simply means programmed cell death, specifically in structurally organized fat depots like the infrapatellar pad. A study in the journal Osteoarthritis and Cartilage found that infrapatellar fat pad volume decreases significantly in postmenopausal women compared to age-matched premenopausal controls, with reductions measurable on MRI imaging. The volume loss is real and anatomically documented. No topical product reaches this layer. It is too deep for surface application to have any structural effect. The intervention must come from the inside. 1 tablespoon of ground chia seeds every morning. Stir into yogurt, oatmeal, or water. Chia seeds are among the most concentrated plant sources of omega-3 fatty acids, specifically ALA. ALA simply means alpha-linolenic acid, a fatty acid the body converts into the anti-inflammatory compounds that protect adipocyte health and reduce the inflammatory signaling that accelerates fat pad cell death. 1 tablespoon. Every morning, the consistency of delivery matters more than the quantity on any single day. If you are learning things in this video that you have never heard from any other source, please subscribe to this channel because everything I share here is built specifically around the female body after 50. And there are 2 more factors coming in this video that are going to change what you do every single morning. The third factor operates at a level of the skin tissue that is even harder to see than the fat pad. But you have felt its absence every time you pinched your knee skin and noticed it no longer snapped back the way it once did. Root factor 3, elastin fiber permanent deformation. This factor explains a phenomenon that is genuinely different from collagen loss, and it is the reason that even when collagen synthesis is supported through diet and supplementation, the skin over the knee still lacks the snapping back quality it once had. You might think, elastin is just another protein like collagen. If I support one, I support the other. And that assumption is understandable, but it misses a biological reality that changes everything about how you approach knee skin recovery. Collagen provides structural strength. Think of it as the walls of a building. Elastin provides recoil. Think of it as the springs in a mattress. These are functionally different proteins produced by different cellular processes, and after 50, they fail by completely different mechanisms. Here is the biological path for elastin specifically. Fibroblasts. Fibroblasts simply means the primary collagen and elastin-producing cells in the dermis sharply reduce their elastin gene expression after menopause. This is not a gradual decline. Studies in the Journal of Investigative Dermatology show that elastin synthesis in postmenopausal skin drops by approximately 40% compared to premenopausal baseline within the first 5 years after menopause. 40% reduction in the very cells responsible for maintaining the tissue's recoil capacity. Simultaneously, the existing elastin fibers that remain undergo permanent stretch deformation from thousands of daily knee flexion cycles. They stretch and simply do not fully return, like a rubber band that has been overstretched too many times. Standard collagen creams and supplements do not address elastin because they do not activate elastin gene expression pathways. They are solving only half the problem at best. The topical solution costs almost nothing. Separate 2 eggs, keep the whites, and apply 1 egg white directly to the clean skin over and around your knee. Leave it on for 15 minutes, then rinse with cool water. Do this 3 times per week. Egg white albumin. Albumin simply means the primary structural protein in egg white creates a temporary tightening film on the skin surface that mechanically reduces the visible folding while the internal protocol works beneath. More importantly, eating the whole eggs daily, 2 eggs every morning, supplies dietary proline and glycine, the 2 amino acids that serve as direct precursors for both collagen and elastin synthesis. The topical application works at the surface. The dietary eggs work at the cellular level. Use both. The fourth factor is one that most people associate with joint health, not skin appearance. And that surprising connection is exactly why almost no one addresses it when treating knee skin laxity. Root factor 4. Hyaluronic acid depletion in the knee dermis. This factor is responsible for the specific papery, thin quality of the skin over the knee, the sensation you described in the self-check at the beginning of this video. And it operates through a mechanism that is almost never discussed in the context of skin tightening. Your first thought might be, I have heard of hyaluronic acid. It is in my face serum. And you are right that it is a widely used skincare ingredient. But here is what the label on that serum does not tell you. Hyaluronic acid molecules applied topically are far too large to penetrate the dermis. They sit on the surface, create a temporary plumping effect from surface moisture, and wash off. The hyaluronic acid your skin actually needs is produced internally by specialized cells called fibroblasts and keratinocytes, and it lives deep inside the dermis, where its job is to bind water molecules and maintain internal tissue pressure that keeps the skin pressed outward and taut. Here is the biological path. Hyaluronic acid in the dermis is continuously produced and continuously broken down by an enzyme called hyaluronidase. Hyaluronidase simply means the enzyme that degrades hyaluronic acid into smaller fragments. In the knee dermis specifically, this breakdown rate is accelerated above normal because constant mechanical compression of the joint during sitting, standing, and walking physically forces hyaluronic acid fragments out of the tissue faster than they can be replaced. A study published in the Journal of Anatomy found that mechanically stressed skin regions show hyaluronic acid turnover rates significantly higher than non-stressed regions, with the knee ranking among the highest in the body. The knee loses this critical hydration molecule faster than almost anywhere else. Topical hyaluronic acid serums cannot fix this. The molecule never reaches the dermis. 1 cup of bone broth daily, or 1 tablespoon of plain unflavored gelatin dissolved in warm water with the juice of half a lemon. Bone broth supplies glucosamine and glycine in bioavailable form. Glucosamine simply means a natural compound that serves as a primary building block for hyaluronic acid synthesis inside the body. When glucosamine is delivered through diet, the body uses it to produce hyaluronic acid endogenously. Endogenously simply means manufactured from within the body's own cellular machinery, and deposits it directly into the dermal layer of the skin. This is the only delivery method that actually reaches the dermis, 1 cup every morning before 10 a.m. The fifth and final factor is the one that determines how quickly every other intervention in this protocol actually works, because without it, the nutrients you consume never fully reach the knee dermis at all. Root factor 5, localized circulatory insufficiency around the knee. This is the factor that silently undermines every other thing you do for your knee skin. And it is the reason 2 women can follow the same dietary protocol and get completely different results, with the difference coming down entirely to one physiological variable that almost no one thinks to address. You might think, my circulation is fine. I walk regularly and my blood pressure is normal. And general circulation may well be adequate throughout your body. But the knee is a terminal circulation zone. Terminal circulation zone simply means an anatomical region where blood must complete a sharp directional turn to return from the extremity, creating a natural bottleneck in both arterial delivery and venous return. The knee joint itself, with its complex mechanical structure, creates additional resistance to microcirculation. Microcirculation simply means blood flow through the smallest capillary vessels that actually deliver nutrients directly to the skin cells of the dermis. When microcirculation to the knee dermis is insufficient, collagen precursors, glucosamine, omega-3 fatty acids, and EGCG from your diet cannot be delivered to the cells that need them. A study in the journal Microvascular Research found that postmenopausal women show a measurable reduction in cutaneous microvascular reactivity, meaning the small blood vessels in the skin respond less efficiently to demand signals, with reductions of up to 38% compared to premenopausal controls. 38% less nutrient delivery to the very skin you are trying to rebuild. His is why some women supplement correctly and still see slow results. The delivery system is compromised. His solution requires no equipment and costs nothing at all. During your morning shower, direct the shower head specifically at your knee and alternate between 30 seconds of warm water and 30 seconds of the coldest water your tap produces. Repeat this cycle 3 full times. Warm, cold, warm, cold, warm, cold. This contrast hydrotherapy simply means the therapeutic alternation of warm and cold water application to drive vascular response. Triggers vasoconstriction with the cold and vasodilation with the warm in rapid alternation, creating a pumping action in the blood vessels of the knee skin that forces fresh, oxygenated, nutrient-rich blood into the dermis with each cycle. 3 cycles. Every morning shower. 30 seconds warm, 30 seconds cold, 3 full rotations. The increase in local circulation means every other element of this protocol, the green tea, the gelatin, the chia seeds, the eggs, gets delivered to the knee dermis with significantly greater efficiency. Practical protocol, I am going to give you the complete 4-week system. Every element has a specific position in the sequence, because each week builds the biological foundation that the following week requires. Do not skip weeks and do not rearrange the order. Week 1, enzyme control and internal hydration, days 1 through 7. The first priority is stopping the destruction before rebuilding can begin. Every morning, 2 eggs, scrambled, poached, or boiled, your preference, eaten within 30 minutes of waking. Immediately, follow with 1 cup of bone broth or 1 tablespoon of plain gelatin dissolved in warm water with the juice of half a lemon. 1 tablespoon of ground chia seeds stirred into yogurt, oatmeal, or the warm gelatin water. Every afternoon, 1st cup of green tea brewed for a minimum of 3 minutes. 2nd cup of green tea in the early afternoon, again brewed for 3 full minutes before drinking. Do not rush the brew. The EGCG concentration doubles between a 1-minute and a 3-minute steep. Every evening, 3 times this week, egg white knee mask. Separate 1 egg, apply the white directly to clean dry skin over and around both knees. Leave for exactly 15 minutes. Rinse with cool, not warm, water. Cool water closes the surface pores and temporarily firms the surface film. Week 2, circulation activation, days 8 through 14. Add contrast hydrotherapy to your morning shower. Warm water on the knee for 30 seconds, cold for 30 seconds. Repeated 3 full cycles before you finish showering. Continue all week 1 elements without interruption. Add a 5-minute self-massage directly above the kneecap each evening using gentle circular motions with your fingertips. This stimulates local lymphatic drainage and complements the vascular pumping you are creating with the hydrotherapy. Week 3, structural muscle activation, days 15 through 21. Add VMO activation exercises. VMO simply means the vastus medialis oblique, the teardrop-shaped muscle visible on the inner side of the knee just above the kneecap, which when contracted pulls the overlying skin taut from beneath. Perform slow terminal knee extensions. Stand with a resistance band or firm elastic looped behind your knee, step back slightly to create tension, and slowly straighten the knee from 30 degrees of bend to fully straight. 3 sets of 15 repetitions each leg, once daily. The VMO contraction during this movement creates a mechanical lift on the skin above the kneecap that no topical product can replicate. Add fascial rolling above the knee. Use a foam roller or a plain kitchen rolling pin on the skin directly above the kneecap, rolling from mid-thigh downward toward the knee in slow, firm strokes, 2 minutes per leg. This restores mobility to the collagen matrix and increases local blood flow to the target zone. Week 4, full system integration and bonus technique, days 22 through 28. Add the overnight raw honey compress, the bonus technique I held specifically for this week. Apply exactly 1 teaspoon of raw honey, not processed honey, raw honey specifically, directly to the clean skin over each knee before bed. Cover loosely with an old cotton sock, cut at the ankle, or a soft cotton cloth. Leave on overnight. Raw honey contains hydrogen peroxide precursors that gently stimulate fibroblast activity, gluconic acid that supports surface pH balance for optimal skin cell function, and natural humectants. Humectants simply means compounds that draw moisture from the air into the skin, that support dermal water retention at the surface level overnight. Rinse off with cool water in the morning before your contrast hydrotherapy. By week 4, you are running all elements simultaneously. The green tea suppresses MMP destruction. The chia seeds protect the fat pad. The eggs and gelatin rebuild collagen and elastin. The bone broth restores dermal hyaluronic acid. The contrast hydrotherapy delivers everything to the target tissue. The VMO exercise provides mechanical lift. The honey compress supports overnight fibroblast activity. These are not 7 separate tips layered on top of each other. They are 7 inputs into one integrated biological repair process, and the system produces results that none of the individual elements could produce alone. Now, I want to speak to you specifically about your decade, because the dominant mechanism in your knee skin right now changes significantly depending on where you are in the aging timeline, and that changes which element of this protocol you need to prioritize most urgently. If you are in your 40s and noticing the first signs of knee skin loosening, your MMP enzyme upregulation is in its early acceleration phase and the infrapatellar fat pad is just beginning to lose volume. Your most powerful intervention right now is the green tea protocol and the chia seed omega-3. You are in a window where interception produces dramatic results because the structural damage is still early. If you are in your 50s, elastin fiber deformation and hyaluronic acid depletion have both been compounding for several years. Your protocol priority is the egg-based dietary support combined with the daily gelatin and bone broth. The dermis needs raw material delivery urgently, and the VMO activation exercise will produce visible changes faster at this stage than at any other decade. If you are in your 60s or beyond, circulatory insufficiency becomes the dominant limiting factor. Every nutrient intervention you do is only as effective as the microcirculation that delivers it. Your non-negotiable daily practice is the contrast hydrotherapy. 3 cycles, every single morning shower, without exception. Combined with the evening knee massage, you are rebuilding a circulation pathway that your skin has been operating without for years. Drop your exact age in the comments below this video right now. I respond to age-specific questions in the comments because the recommendation genuinely changes by decade, and the answer I give a 48-year-old is clinically different from the answer I give a 63-year-old. 5 root factors. 5 specific, measurable, kitchen-accessible solutions. 1 integrated system. Factor 1 is MMP enzyme overactivation, destroying collagen faster than it can be rebuilt. Addressed with 2 cups of green tea brewed for 3 minutes every day. Factor 2 is infrapatellar fat pad atrophy, withdrawing the structural support beneath your skin. Addressed with 1 tablespoon of ground chia seeds every morning. Factor 3 is elastin fiber permanent deformation and declining elastin synthesis. Addressed with the 3 times weekly egg white knee mask and 2 daily eggs for internal amino acid supply. Factor 4 is hyaluronic acid depletion in the knee dermis. Addressed with 1 cup of bone broth or 1 tablespoon of gelatin with vitamin C every morning. Factor 5 is localized circulatory insufficiency, preventing nutrient delivery to the target tissue. Addressed with 3-cycle contrast hydrotherapy in every morning shower. When these 5 interventions run as a system over 4 weeks, they address every layer of the structural collapse simultaneously, surface, dermis, and the fat pad beneath, and produce changes that no single ingredient approach has ever been able to deliver. One important clinical note before you go. If you notice sudden swelling, warmth, redness, or pain in or around the knee joint rather than just the overlying skin, please seek immediate medical evaluation. These signs can indicate intra-articular pathology, including effusion or early osteoarthritic inflammation that requires clinical assessment, not a home skincare protocol. This protocol supports your body's natural collagen synthesis, circulatory function, and tissue maintenance. It does not replace a clinical evaluation of your individual health status and should never delay you from seeking medical care for a symptom that concerns you. No clinic will offer you what I gave you today, because there is no procedure code for green tea, no billing model for a raw honey compress, and no consultation fee attached to a kitchen rolling pin. The financial structure of aesthetic medicine is built entirely around treatments, not mechanisms. And the moment you understand the mechanism, you stop needing the treatment. This channel exists for one reason: to give every woman over 50 the same quality of clinical reasoning she deserves in an exam room, delivered directly, for free, without a waiting list. My name is Dr. Elena Voster. 15 years of clinical practice, I can tell you with complete confidence, what you see when you look at your knees is not a flaw. It is a set of specific biological signals that your body has been sending, waiting for someone to give you the right translation. Today you have it. If this video gave you something useful, please share it with one woman in your life who is sitting in a chair right now looking down at her knees and wondering if anything can actually help. She deserves the correct information. And if you are not yet subscribed, subscribe now. Not for the numbers, but because the next woman searching for answers about her body should be able to find this channel when she needs it most. I will see you in the next video.